Keep the drum beat.
Hello.
Okay, we are 3, 2, 1. A warm welcome to you from Geneva, Switzerland. This is a consultation amongst friends, colleagues who've been supporting each other in some cases since 2016, when the Geneva Learning Foundation first launched its immunization program working with the World Health Organization. Now, just a point of order before we start. If you are an English speaker, there are francophones in the room. So please make sure you have interpretation turned on. Choose the English channel. You may need to mute the original audio. And for the francophones, here are the same 3-step instructions of course, in French this time. All right. I believe most of you are familiar with our Zoom studio and how we work. So I'm going to dive into to explain the consultative approach that we will be taking today. So first of all, I'm going to share in the chat and I'll show you where it is. Let me turn on the chat here. Yep. You can see my message here. So add your inputs and comments to the manifesto. And so because not everyone is going to speak, because in some cases it can be hard to understand chat comments, you click on that link and that will take you straight to the manifesto in both languages. So I can see there's a few people up here who are accessing the document. I encourage all of you to have a look. Now, if you're on your phone, I would suggest stay in Zoom. Don't try to go to Google Doc. Stay only if you are on your phone. And so here, as we review each of the sections of this manifesto, we would have a very simple process. Before you request to speak, try to summarize your suggestion or comment in the chat. And then to request to speak, please raise your hand. So this helps you compose your thoughts. This also helps Charlotte decide whether this is something we really need to hear orally, or whether the written comment is sufficient to understand what you are saying. So you will have to be patient. And again, we suggest a chat and writing directly into the Google document, because that is this way everyone can add their contributions. But we still are also very much looking forward to hearing your voices. Now, if someone from your own country has just spoken, or someone of your own sex or gender. So if a man has just spoken, please lower your hand so that someone from another country or gender can speak. So those are the ground rules. I'll show them once again in French and in English. And that is the entire process for the consultation. I believe we are, I'm just checking to see if Ian Steed from our Insights unit, who's worked on the manifesto, is in the room with us. He doesn't seem to be, so I'm just checking on him before we get started. So we'll spend about 10 minutes on each segment, and we will start, of course, at the beginning, so which is really the statement of purpose for the manifesto. And again, as we see comments appear, so let me demonstrate how you add a comment. So if you wanted to say that, it should be, you want to add a comment here in French or on the English side. Let me demonstrate in English, so I'm speaking in English. So you say the goals, rather than saying the goals, you wanted to make a comment about IA 2030 and ask. So you just click on the little comment box and you say, should we mention other strategies? And then click on the blue comment button, okay? And then your comment will appear. Now, do not click on the check mark if you see someone else's comment, because that will make their comment disappear. I'm going to delete my own comment. You don't want to delete your own comments. You want to add them. And again, I'm going to give the link, especially, so this is especially useful if you are on a desktop. So I now call for the first oral contribution. So the first person who will speak about this, to make a suggestion or recommendation in response to the to the first part of the manifesto. And while you compose your thoughts, I'm going to ask Charlotte if she is ready to do so, to read this first part of the manifesto. I'm just also wondering whether we should skip down to who we are and where do we work. And if you could, if there are comments on that first section, probably best to enter them directly. Let me just see. Okay, here. Okay, so we have an anonymous comment to add paragraph. So while we appreciate your comments about grammar and spelling, or just the way the document is organized, that we will do a proofreading by a professional proofreader or editor later. So you do not need to worry about what the document looks like. I agree it doesn't look great right now, but what we want is your thoughts, your questions about the document itself. Charlotte, do you have a copy of the document in front of you in order to read for us the first section, who are we and where do we work?
Yes, Reda, I have it open in front of me. Just time for me to scroll. Okay, so yes, I am ready. So can I go ahead?
Yes, please.
Okay, so while many of us have trained as health workers, we also come from other professional backgrounds: teachers, social workers, scientists, academics, and technicians. Some of us are volunteers. We receive little or no payment for carrying out health work in our communities. We come from all levels of health systems and are aware of the strengths and limitations of these large and complex organizations, and the critical role of political direction and leadership in making these systems work. Some of us lead big teams at national and or regional level. Others are responsible for specific areas of work within a local facility or across several facilities. Many of us work with poor communities. For some of the people we work with, healthcare is not a priority above economic activity to survive. The communities we work with may be geographically hard to reach, suspicious of government, and by extension us, or hold religious or cultural beliefs that do not easily adopt the science we base our work on. Some of us highlight how decisions about housing, sanitation, and education affect the health of the communities we serve. But decisions on these things are made without reference to population's health needs. COVID-19 has, for many of us, highlighted the fragility of the systems we work in and our relationships with communities. For some of us, it has meant more investment and renewed political focus on healthcare. For others, it has meant cuts in key budgets and the rise of new threats to our work, such as rumors spread by social media. Many of us remember the fear of the early days of the pandemic and losing colleagues and friends, and often carried out our work without adequate protective equipment. For some of us, this period confirmed why we signed up to work in health. For others, this period was a source of mental stress and anxiety. Each of us is working in a unique context. The nuances of community structure, culture, and religion interact with the structure's image and resourcing of our own health systems. To be successful, we must make this interface work. Those of us who work in humanitarian contexts report further dimensions of complexity in our work. Our security is often not guaranteed. The facilities and equipment that we rely on may be targeted and destroyed, and our target populations may be inaccessible and displaced. Thank you, Reda. Over.
Thank you very much indeed, Charlotte. Okay, so now we need, it would be good to hear a reaction orally from someone who has contributed to this manifesto. Remember how we developed this manifesto? We asked you questions ahead of Teach to Reach 8 and received over 1,200 responses around some of the themes that you now see have been integrated into this. So I suggest we start with, let's see. So we'd like to hear, I've posted some questions as you've now listened to Charlotte read this first part. How does it make you feel? Do you feel it adequately represents your experience? And again, the question this section is trying to answer in the manifesto is, who are we and where do we work? So I see a first hand raised from Françoise Bogueke, and very happy to see a francophone who is not intimidated by the fact that Charlotte and I are both speaking in English. Françoise, you'll have to unmute now, and then Babacar Man, in case Françoise is unable to do so.
Bonjour, Rida.
Bonjour.
Hi, Rita. Hi, Rita. So yes, what Charlotte just read is very similar to the things that I wrote because socio-political crisis, for instance, is something that caught my attention. And due to this socio-political crisis, the health agents and the community agents cannot do properly their job because the communication is limited, the equipment for work can be damaged because of the road conditions or the oppressors. I don't want to be too political, but that's the name I give to them. In Ivory Coast, we have this problem, but yes, I think it sums up pretty much what we're living in West Cameroon, this socio-political situation. And vaccination, yes, we have isolated areas that are difficult to target, and not only the community-based agents, they don't have the proper means to get there to these isolated areas, but there is also the added danger of going there, and where the equipment is destroyed sometimes. So that's what I wanted to add. So we cannot ask these people to go to the peripheral urban centers. It's a expenditure in terms of vaccination, zero dose targeting to comply with the vaccination schedule, for instance.
Thank you, Françoise, for this contribution. All right, we have Babacar Mané. So, of course, we are recording the meeting, and Françoise, your contribution will be reviewed and incorporated into the manifesto. Any specific points that we find are currently missing. Babacar Mané, over to you. What is your contribution for this? Your thoughts for this section? Who are we, and where do we work? And the first preliminary question is: does this represent your own experience? Okay, Babacar.
Bonjour. En fait, je m'appelle Babacar Mané. Je suis infirmier
The connection is breaking.
Okay, I believe we have unfortunately lost Babacar Mané. So Babacar, if you can hear us, please use the comments and then use the link you can add your inputs and respond in the chat in the comments. And again, we'll be collecting, reviewing everything that you write in the chat, reviewing everything that you input into the document itself, in order to really collect for everyone to be able to contribute. But if you have good connectivity and you have a working microphone, please raise your hand. We would also love to hear your voice. We know everyone, if you made the effort to come here, it means that you have something. You have expressed, you have shown your interest. Charlotte, let's go to the second section, and then of course we won't necessarily read all the sections, but it was actually quite powerful when you read the first segment.
Reda, I just wanted to indicate that Melese has been able to unmute. He wanted to comment on the
his microphone was not working before, but we can try again. Melese?
Yes.
And don't forget
Melese,
to introduce yourself.
Can you hear me? Can you hear me, please?
Yes, please speak loudly. Yep.
Okay, thank you, Charlotte and Reda. I have reviewed the manifesto and tried to add my parts as a compliment. So in the first session, I recommend to have some important points that I think to be very good. So many individuals from especially in limited resource countries are victims of different preventable communicable diseases. So this may be one reason that professionals try to be one of the contributors in the health-related activities. So being a victim, being an experience in the different communicable diseases is also one reason to be a health professional, and knowing the environment and also knowing the challenges in their areas, also one thing that initiates them to be part of the health professionals, and contributing also for the health status of the community is something that proud you to be. So these all are very important points that need to be included as a reason that individual need to be a health professional, in addition to having an opportunity to just get unemployment. To the next session, most of, especially in low-level countries, most of health professionals are assigned in another area at the first time, and their expectation with the assignment is totally different. That makes them to be challenged to address or to just continue their job as their expectation. This is one thing that may be challenging professionals, especially in low-level countries. So organizing healthcare facilities and infrastructures is very important to keep professionals to be part of or to continue their job as their first preference is very important. It's actually complemented in the Google document. And the last, continue communication in participatory decision making is very important for good working environment in healthcare professionals. So if there is participatory decision making, if there is participatory environment, that is, the health professionals maybe feel good, feel part of the decision making, and feel that they are just planning to work so that they will take the responsibility as well. Thank you.
Thank you very much, Melissa Teferi. Just a quick explanation about the questions that you see. These are the sort of follow-up questions that we'll be asking ahead of Teach to Reach 9 so that everyone can respond to them. If you can think of how to improve these questions, what we want is really for somebody, a health person, to read that question and say, okay, this is something I want to answer. So, Charlotte, we're at 18 minutes into this consultation that will go up to the 45-minute mark. So I suggest for anyone who hasn't been able, so I lowered all the hands. I think there were some old hands from before the consultation started. So please raise your hand after you have made your suggestion or comment either in the chat or in the Google document or both. And then we'll come to you so we can hear directly from you about the manifesto. I suggest, Charlotte, you now read the section on what motivates us to work in global health.
Yes, Reda. Many of us describe growing up in communities with limited access to health workers and experiencing the avoidable deaths of family members and friends at young ages as a factor that motivated us to become health workers. The sense of serving our communities is strong and is a sense of the importance of our roles and the respect that they can engender among community members. For some of us, health work is seen as a stable career that allows us to support families, and a few of us are being recruited to fill gaps in European health systems. Yet for others, pay is irregular and promises of payment are broken. Fortunately, money is not our only motivation. We speak of the feeling of success when a child is reached and cured or immunized against a life-threatening disease. We describe being motivated through involvement in decisions that affect us, through the recognition of our leaders as well as community members, and through the ongoing support of partners who want to support our communities to be healthy.
Thank you, Charlotte. We now open up. I see Gifty Akusoa Adzigbe, who has her hand up. So let me ask her to unmute, and we're also looking for your comments and contributions in the chat. So in principle, Gifty, we would come to you after having shared your contribution. Let's hear you. You just heard the section of the manifesto titled, "What Motivates Us to Work in Global Health?" How does this make you feel? Do you feel represented by what Charlotte read? What else do you want to say? Do you think the manifesto should say? How can we improve it? And maybe another question about who are we saying this to? But don't forget to introduce yourself first and then take on the questions that you think are the most important.
Okay, thank you. Hello, everyone. My name is Gifty Akusoa Adzigbe. I'm from Ghana. I'll say I'm also currently a Mandela Washington Fellowship alumni. It's a privilege to be here. I've read through the manifesto. Charlotte, thank you so much. And the part I want to add to it is that, yes, what is motivating some of us to do what we are doing in our communities is, first of all, our own biological sister who has been a deaf, and you can just put yourself in the shoes of someone who was a normal child that you see to be, and because of just missing a jab, that is measles, and now a deaf, should tell you how important immunization is. I'm talking about 0 to 5 years child immunizations. So with this, what is motivating me more is that despite the challenge as a family, we're able to see her through, to be able to fit into society, which was not easy, and also to be able to access healthcare with the use of the sign language. And that is why where I'm working for the past 9 years, I've also been doing my best to also contribute the same way for persons with disability, that is the speech and hearing impaired, to be able to access quality and also equal healthcare at any time. And I will say the part that I want us to include in this part is that it's time for us to do health inclusion. We say it verbally, but sometimes we don't see it practically. We say inclusion, we say diversity, we say equity, but when it comes to people who cannot speak, and here I'm talking about the deaf community, we hardly show that interest. For instance, somebody comes to the child welfare clinic and is coming for immunization due to that child, and we just take the baby from the mother and we start giving the immunization, and we ask ourselves, how were we able to communicate? Because we know before you give any vaccine, you're supposed to explain, the benefits and also even the side effects to the mother, so that you can allay anxiety. But this mother is just they just take the baby from the mother and we just vaccinate and then they go back. So if we can include something like the health inclusion, and we say inclusion, we want it to be practical, where maybe health workers will be more trained on the use of the sign language, so that they can also help to explain to this mother to seek their consent and to also see the need for the vaccine. So that it will not be like maybe the moment they see the child crying, maybe to even discourage them from coming for the next dose. And we know what we don't want to have a 0 dose, or we don't want to have a chance whereby the child comes for first dose and will not come for the 3rd dose. We want a child to take all the vaccines. So if health inclusion is to be put in place, then it too should be part of this part of the manifesto. Thank you.
Thank you very much indeed for this contribution, Gifty. Are there other contributions? I don't see any other hands raised. So remember, you have 3 options. You can type your message in the chat. That's the best way to get our attention. You can also make comments directly to the Google document. And I can see if you are not logged into Google, then I suggest you leave your name so we can recognize your contribution. But you do have the option to be anonymous. And then third, of course, is to raise your hand if you feel, and I think we're hearing some powerful experiences. So I also encourage you to raise your hand if you really want to share something that you feel is is not in the manifesto, or in fact that really shows that this manifesto is speaking to your experiences. We are interested in both cases. So now that was the preamble to the manifesto. Charlotte, now we're going to hear about health systems, equity, and investment.
Yes, Reda. Many of us are concerned at the sustainability of the health systems we work in, citing missing human and medical resources to carry out our current roles, let alone expand services to reach hard-to-reach communities or communities in humanitarian settings. This affects our motivation as to missing monthly payments and lack of long-term planning for health system financing. Many of us mention equity as something to strive for in our health systems. It hurts us when individuals cannot prioritize healthcare for economic reasons and relatively minor issues escalate through lack of care. The need for more investment in structures, supplies, equipment, and staffing appears universal if global targets are to be met. At the same time, some of us see greater focus on preventive medicine as critical to reducing pressures on existing systems. Multidisciplinary teams and greater integration to care coordination are seen as ways in which we can work more efficiently. Several of us see national insurance systems as a possible basis for inclusive and sustainable healthcare in the future, while others wonder whether healthcare will inevitably become too expensive for the poorest people in our societies. The need for intelligent investment across health systems is a recurring requirement for the future.
Thank you, Charlotte. We now turn to you in the room to hear. Let's have a look at some of the contributions in the chat. I think there's some. Fanny, you wrote about, you said the manifesto should sail, and it resonates with me. And again, every sentence is based on what you told us before Teach to Reach 8. Remember, we ask you all these questions. We ask those questions to give you something back. And what you are hearing and listening to today and contributing to is really reviewing, did we get it right? How can we further strengthen and improve the power of this manifesto? So I don't think we have heard from. I think we should turn to a francophone now. Perhaps we can go to Fuseni. I hope his microphone and connectivity are with him. And then we also have Dr. Tusimi Ramadan, Kingsley Kofi Ninyere, Gladys, looking for countries that haven't been heard, that we haven't heard from yet. Maybe Victoria from Kenya. Victoria asking you, yes, okay, great. And asking you to unmute, Victoria. Yes, the floor is yours. Preferably speaking to the specific question on health systems, but more generally, tell us, what are your thoughts on the manifesto?
Thank you, Reda. I think I'm very happy with the manifesto. It basically touches on what we've been talking about. The only thing I wanted to just highlight, especially based on the health system, we know it's like a seven-legged stool. Without one or the other, it's definitely bound to fail. So one of the things that we need to also emphasize in the manifesto is, as we are working on integration, we really need to have checks and balances, or a checklist of things that must be incorporated, and mechanisms where we have continuous accountability about this integration process. Because when everyone talks about integration, it's very easy, but actualizing it and being accountable and ensuring that we actually get what we want from it, that's always a challenge. So as we are putting it down, I believe this is one thing that we need to also hold ourselves accountable as we are putting everything into the health systems and integrating it. I hope it's clear.
Thank you very much, Victoria Gamba, for this contribution. Who shall we hear from next, Charlotte?
For now, Red and Nova raised hands. I don't know if
well, you know what we do in such cases.
Connectivity issues. Earlier on, I had seen a raised hand from Basil Ngoncha. I don't know if Basil, you're able to unmute yourself and to share your thoughts on this
Oui,
manifest.
merci. Oui, merci, bonjour.
Yes, thank you very much. Hello. Earlier, when you talked to me, I think I had problem of connection. I think that is very clear now. Yes, indeed. So my name is Basil Conchar. I work for the Center of Health, where I'm in charge of immunization. I'm extremely impressed by this way of learning because you really are like you going back to school. This manifesto is the fruit of a common work and scientific very advanced, where all their peers could give their point of view. So I was quite struck by the passion of everybody. And a lot of people are saying that they're working with poor community for which health is not a priority because of their activity. The fact of putting a priority of what people are the children are going to eat is, of course, the most preoccupying issue in my community and just about everywhere. Life is very expensive. Inflation is rampant. There's the war of Ukraine everybody made it expensive. We have problem of health. We have children that we have to send to school and we have to feed. And we're very surprised to see so many people are coming to hospital and having disease that you could avoid throughout vaccination. So if I had something to advocate here or to add to this manifesto, was to advocate near the government on the level, on the national and infranational level, so that they give us the means and resources to centers of health or various districts to have more resources for communication so that population pay more attention to immunization. Having some kind of proposals, for instance, if you have a vaccine, you have a kilo of rice. Then I'm sure that they're going to rush and they'll have a kilo of rice, or offering food or nutrition ways, because this is one of the issues why people abandon hospital and think they can find health just by eating, as of course it's a mistake. So there is a problem of education on the level of school also, where a lot of people are not paying much attention to documents talking about health. So even when you post posters talking about health issue, for instance, fights against poliomyelitis or cholera, not so many people are reading. But so many people say, we didn't see the poster. The whole families are coming from 6 o'clock in the morning and coming back at night just to find food to feed the family. So the money is an issue. And this is one of the major obstacles for motivation for the population to have immunization. This is what I wanted to say, and thank you for your attention. Thank you, Basil. Reda?
Thank you, Basil and Goncha. No, I suggest with the time remaining, Charlotte, I suggest you read the 3 remaining sections of the manifesto. So knowledge and learning, they're shorter than the first ones. You can skip over the questions. So the questions are, the sections are knowledge and learning, trust and transparency, digital technologies, and then partnership and coordination. And then once we've actually just allowed ourselves to listen to what this manifesto sounds like, then we'll use the remaining time to receive more contributions. But just to answer quickly some of the questions in the chat. So Francis Kitolo wanted to know if today was the only time to be able to make inputs. No, we'll be receiving inputs probably for another week. And then wrapping it up, preparing Manifesto version 2 for Teach to Reach 9 on the 13th of October. After Teach to Reach, we'll be receiving new inputs, and then that will probably prepare, I don't know if it'll be version 2.1 or 3.0. We'll see how it is received, but we will be inviting you, because this is your manifesto and it is your ideas, your experiences that have made it possible, you will be the ones invited to present it at Teach to Reach 9. Alidia wants to know, wants to emphasize the question of leadership, so that's noted, as well as the question of coordination. Now, Charlotte, over to you to hear really what this sounds like in our ears when we, and our minds and hearts when we listen to this, the last sections of the manifesto.
Thank you, Reda. Under knowledge and learning, we recognize the power of learning as something that can transform the way we work. The diversity of our contexts mean that we work with both scientific knowledge of the right way to do things and the knowledge that comes from knowing a particular context and the social, political, and economic factors that shape people's lives in a given community. Success is based on us combining these factors effectively. Some of us are concerned that inadequate investment is being made to train up new entrants into our industry. They are not equipped with the knowledge and skills to take on these complex tasks. Many of us point to the inequities in global health knowledge, which prioritizes global knowledge over context-based expertise. We respect and enjoy hearing from global experts, but many of us suggest that talking to peers with day-to-day field experience is often more relevant to us. I'll go to the next section on trust and transparency. We recognize the need for trust and transparency, both within our organizations and between our organizations, us, and the communities we serve. A small minority of us note corruption and poor decision-making within our organizations. Many more of us are preoccupied with how to build acceptance with communities and occasionally with different and conflicted factions. The next section is digital technologies. The pandemic pushed change in the ways with which we work with digital technologies. We experience opportunities to connect with peers in other regions and countries and build on their experiences. Digital tools are allowing us to digitalize patients' information, collect and analyze new data, and engage with communities through new media. However, many of us do not have the equipment or consistent internet access to build on this potential. Some of us pay from our own pocket in order to participate in peer learning opportunities, such as offered by the Movement for Immunization Agenda 2030. And similarly, many of the communities that could benefit from these technologies risk further exclusion through poverty and lack of access. The last section we'll look at is partnership and coordination. Some of us have experienced how effective partnerships make a difference in delivering healthcare, whether with international actors or with local private sectors. But it is frustrating, for example, when government departments do not work together, or when international actors do not share data that will allow for more effective collective responses during humanitarian operations. Thank you very much.
Thank you very much indeed, Charlotte. All right, we have maybe 8 minutes remaining, and I know the time is short, but I also know that your time is precious and you are busy. So many of you are busy with your daily duties. So we have these other ways in which you'll be able to continue adding your inputs after this initial consultation. But we wanted to see one, if you would come to discuss this manifesto that is grounded in your experience, and then to hear what matters to you. Charlotte, over to you to choose in line with our gender and country speaking rules. Who shall be next? We have several hands raised.
Yes, Reda. So we are going to start with Caroline Akoshle. Caroline, please go ahead and unmute yourself.
Good morning, good afternoon, everyone. I'm Caroline Akoshile. I'm TGLF ambassador by the grace of God, and I've been participating in TGLF program since 2020. Like I put in the chat, I really relate with the manifesto. It's very good. I can relate to it, and I can see that we still have a lot to add to the manifesto, starting from the first paragraph, because I just saw that even like social, the communication people, they are not really reflected there. We need to put the social communication people there. And then I also think that it would be fine if we can put this manifesto, this document online, so that after today, because now we have very little time to be able to add, we can read it on our own and add whatever we think or should be in the manifesto, because for me, it's like a living document that is going to be there for some time, and then after it can be now finalized. Partnership and coordination, that's the last one that we talked about. Yes, we are really experiencing a lot of effective partnership, learning from one another, mentoring each other, and so on, and then having international actors, actors who do not want to actually share their data. I have such an experience because there was a time we were writing our action points, action report to be submitted for a particular program on TGLF. I tried to get data from a particular organization in my country. They didn't give me. So I think it would be nice for us to put this online for people to really think through more than us spend just 1 hour or so. And then, yes, you can give us like a deadline, maybe 2-3 days for all of us to go through it. And we can add whatever we think should be in the manifesto. For me, it's a very good start. It's a very good work. It's a continuous good work that TGLF is doing. Well done to Charlotte and Reda. Thank you. Over.
Thank you very much indeed. I'm not going to respond fully because I'm more interested in hearing from others, but just to say this is your manifesto, Caroline. It is grounded in what you told us when you took your precious time to answer Teach to Reach questions. So yes, there will be time for you to add the inputs and the contributions for you and others to do that. There's already 1,200 people, health workers, who have contributed in various ways. Who shall we hear from next, Charlotte? And then maybe one final speaker. Remember that you have the opportunity to share in many different ways, including the chat and directly into the Google document.
So rather in the application of our rules of equity, I would like to turn towards Joseph Mbari Gugi from Kenya. Sorry, Umar Abubakar, you're from Nigeria, just like Caroline. So let's listen to Joseph Ngugi from Kenya. Joseph, over to you. Hoping that your connectivity will hold.
Otherwise, we can go to Alain Decam. No, I'm not hearing Joseph. Alain, we'd love to hear from you. A warm welcome to you. You will be one of the last voices we hear about the manifesto today.
Yes, thank you very much. Greetings to everyone. The manifesto is a very nice and very good document, well elaborated. I've not been reacting since the beginning because I really have a lot to say about it. Charlotte has been reading. But I will just start with the proposal, since the manifesto is a document carrying strategies, and you see that people are really willing to update it by giving for their contribution. I think maybe if we make it in such a way that after a certain period of time, maybe 2-3 years, we amend it, it will be a live document and it will never expire. Because the manifesto is experience, and experience change with time. So we have new experience according to the context where we live, and maybe after a period of time, we still need to update the manifesto or have another version. That is the proposal I wanted to make. And concerning the point of digitalization, I think we mostly talk about digitalization with network, but I also want to mention that we work on the field with our phones, our laptops, but we don't always need network. There's a great part of job that we did, like keeping patient information without necessarily have a network. So you can even have pictures that you take to keep record and certain things that we do without network. So network is not really a problem per se, because we always mention network, like we see work online. No, we think digitalization really help, and in the manifesto we can talk about it without necessarily mentioning a network. And I'm sorry that all the time that I have to intervene, I will also come back to the context of crisis, because we talk, the manifesto really mentioned everything concerning the sector, about maybe destruction of health structure.
Thank you, Alain. I think, I suggest you complete your thoughts in the chat. Just eager to hear. We have just a few minutes remaining. Appreciate your contribution. Don't mean to cut you off. I suggest that we have not heard from Asia or Latin America, while we have very dedicated leaders who are here in the room with us. I'd like to go to Faiza Rabbani, and then if I could ask you to be concise, because so that Maria Fernanda Manzan from Argentina would then be our last speaker. Faiza, are you able to speak to us? If not, we'll go to Dr. Manisha Danan from India. All right, I'm asking all three to unmute. Otherwise, then we may if none of the three is able to unmute, then we will end here, knowing this is one step in the process. Yes, Maria Fernanda Manzon. Yes, you will be then our last last person we'll hear from, but everyone can contribute through this process. What would be your closing words and parting thoughts for this stage of the consultation?
Oh, that's a lot of pressure, but I think the manifesto is very good. I like it. I would only like to add very shortly is that I think that in the section of knowledge and learning, we have to specifically mention the TGLF activities and what we've been participating. That should be, written, and I'll think of some paragraph or some short sentence, then we can add there. Then the rest, it really resonates with me. It gives me the chills. Obviously, it's very good. And I'll keep looking at it and reading through the comments and adding things in the document itself. So somebody else, we can keep on going. I think it's very, very good. Thank you.
All right. Thank you, Maria. You'll be our last speaker. We really would like people from all the regions, geographic regions, all countries. And the contributions in the initial 1,200 contributions, obviously we had, I believe, over 80 countries contributing, but we also want to make sure we hear your voices as well. So please do not be shy. That's it for this consultation, but don't leave yet, because we have, after this consultation, you are invited to stay. And we'll be stopping the interpretation, but please stay if you are Francophone. Do not leave if you are able to stay, because we're going to be doing two things you can see here. First, announcing Teach to Reach Connect 9 in English, and then announcing Teach to Reach Connect 9 in French. So we'll be doing the announcements in both languages. It'll take about 10, 15, 20 minutes. With respect to the manifesto, of course, we'll be following up by email, so do check your inbox. We always open access. You can always contribute if you want to. You have to be clear in your mind why you want to contribute to the manifesto. We cannot answer that question for you. It has to be with respect to your own needs and goals, and also to contribute perhaps to the movement for IA 2030 that many of you are a part of. So for the Francophones, we're doing the announcement, the Teach to Reach announcement second. So after the Teach to Reach announcement in French. So I would invite you, and apologies for making you wait. If you do not speak English for the next 30 minutes, you may not understand, or actually 40 minutes, you may not understand very much, but we want to have adequate time to prepare to switch over from this consultation, which I'm now going to stop the recording of, and shift into preparing for the Teach to Reach announcement. So for the interpreters, we ask you as agreed to stay until the top of the hour, and then at that point we'll be speaking only in English, only with English speakers, and will no longer require interpretation. But once again, for me, it was amazing just listening to Charlotte reading the manifesto and then hear your voices. This is again your manifesto, grounded in the experiences that you shared. Thank you once again.